Okay, so the purpose of my speech is to inform the audience of psychological disorders, symptoms, and treatment. The causes of psychological disorders are not known, but a number of factors such as chemical imbalances in the brain, illnesses, and stress. Psychological disorders are also referred to as mental disorders or abnormalities of the mind that result in persistent behavior patterns that can seriously affect your day-to-day function and life. Psychological Disorders 2020. Today, I would like to share with you some information about psychological disorders, such as their symptoms and treatment. I will be covering schizophrenia, depression, and bipolar disorder. I will now start off with symptoms and treatment of schizophrenia. Schizophrenia is a mental illness that affects how a person thinks, feels, and behaves, and may seem like they have lost touch with reality. There are three categories of symptoms of schizophrenia. A brief description would be psychotic symptoms, negative symptoms, and cognitive symptoms. Psychotic symptoms would affect the five senses, hallucinations such as hearing voices and paranoia, as if someone was out to get you, and the way you think and speak. Negative symptoms would be a social withdrawal. Negative symptoms would be social withdrawal, difficulty showing emotion and functioning normally. Cognitive symptoms would include problems processing information, as making decisions, using information immediately after learning it, and trouble focusing or paying attention. Antipsychotic medication can reduce the intensity and frequency of the psychotic symptoms. Many people taking antipsychotic medications have side effects such as weight gain, dry mouth, and drowsiness. Suddenly stopping medication can be dangerous, and it can make schizophrenia symptoms worse. Psychosocial treatments can be helpful for teaching and improving skills to address the everyday challenges of schizophrenia. Individuals who participate in regular psychosocial treatments are less likely to relapse or be hospitalized. Now I will tell you some symptoms and treatments for depression. Not everyone who is depressed experiences every symptom. Some experience only a few symptoms, while other people may experience many. The severity and frequency of symptoms and how long they will last will be depending on the individual and his or her particular illness. Symptoms may be, it depends on the stage of illness. And that was NIMH 2018. Most people who experience symptoms that have been lasting for 2 weeks or more may be suffering from depression, sadness or anxious, feelings of hopelessness or guilt, appetite and or weight gain or loss, thoughts of death or suicide, or even suicide attempts. Depression is a common but serious mood disorder. Current research suggests that depression is caused by a combination of genetics, biological, environmental, and psychological factors. Depression 2020. Depression is now recognized as occurring in children and teens. They tend to become more irritable than low mood. Older adults suffer from depression as well. It usually co-occurs with other serious medical illnesses such as diabetes, cancer, heart disease, and Parkinson's disease. Depression, even the most severe cases, can be treated. The earlier the treatment can begin, the more effective it is. Depression is usually treated with medications, psychotherapy, also known as counseling, or a combination of the two. If these treatments do not reduce symptoms, electroconvulsive therapy, also known as ECT, and other brain stimulation therapies could help. Antidepressants are medicines that are prescribed and can treat depression. They may help improve the way your brain uses certain chemicals and that control your mood or stress. You may need to try several different antidepressant medicines before finding the one that improves your symptoms and has manageable side effects. Stopping them abruptly can cause withdrawal symptoms. Several types of counseling can help people with depression. I will now tell you some symptoms and treatments for bipolar disorder. Bipolar disorder, formerly called depressive illness or manic depression, is a mental disorder that causes usually shifts in mood, energy, activity skills, concentration, and the ability to carry out day-to-day tasks. NIMH 2020. Sometimes people experience manic and depressive symptoms in the same episode. People experiencing an episode with mixed features may feel very sad, empty, or hopeless while feeling extremely energized. A person may have bipolar disorder even if their symptoms are less extreme, which is called hypomania. The person may not even feel anything is wrong, but friends and family can recognize the changes in mood or activity levels as possible bipolar disorder. Without proper treatment, it could get worse. Treatment can help people, including those with most severe cases of bipolar disorder. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some of them have lingering symptoms. Long-term continuous treatment can help people manage these symptoms. Bipolar disorder 2020. Some people may need to try several different medications to work. Medications generally used to treat bipolar disorder include mood stabilizers and antipsychotics. Psychological disorders affect the brain in many ways, but by catching the symptoms and starting treatment as soon as possible, the disorders can be helped. However, we learned the symptoms and treatment of schizophrenia, depression, and bipolar disorder. Although this speech does not cover all the information on disorders, I hope it keeps your mind open and how to look out for symptoms and get the proper treatment to help.